Hi, this is Dr. Surjit from Capital Chiropractic, and what I want to go over today is a question that came in from one of our patients. And the question is, hi Dr. I have a question. I've been talking to people about your technique, your table, and how your treatments are so much more effective than previous chiropractor I've seen. So my question is, why is your technique much more effective than others, and what is the role of those treatment tables? So that's a great question, Eric. And first of all, I start off with our tables. So our tables are a bit specialized because our goal here is to make changes, actually make structural changes of the spine. So what does that mean? Especially our headpiece. A lot of people come in with this presentation. We call it anterior head syndrome, where the head has gone forward. So what this allows us to do is when patients lie on our table, they're lying down, their head is here, so the table actually comes up. So what this does, this allows us to work on correcting, you know it as posture, but in our office, we call it structure, bring the ears to line up better with the shoulder. And what is also really unique about our tables is when people come in and they're stuck in things like torticollis or neck pain like this, we're allowed to make gentler adjustments using this table because it's called a drop table. It makes a loud noise here, but what we can do is we can change the position of the table where patients cannot move themselves. So we can move it and we can get it to slide and go up and down. So that makes this table unique in that sense that we can make the patient more comfortable and ready to receive adjustment, especially when they're in a lot of acute pain. As we move down the table as well, one of the features for us as a doctor is we can allow the table to go up and down for different sizes of patients. But then we get into the lower spine because some people, they don't like coming to a chiropractor because they're afraid of that popping and cracking sound. Some people actually love it, but the people that don't like it, they prefer more gentle where they don't feel the popping and cracking happening in their spine, is we can use a drop table. So when a patient is lying, we actually allow the table to help us with the adjustment. So it makes that loud noise there, but then a patient doesn't feel the actual movement. So it's quite a piece of really specialized engineering, this table, that allows us to get neurostructural correction changes. So there, what we're doing is we're getting to the underlying problem in the spine and trying to get the spine closer to normal if it's shifted, versus when we're doing relief care where all we're doing is really just managing symptoms and just kind of patching and fixing. So I hope this answers your question. If you have another question, please feel free. I think this was a great place to start and talk a little bit about the tables.